Welcome back to another episode of Anxiety and Depression Adventures. Tonight's discussion is going to be around not so much the patient, so to speak, or the victim of depression, but more so on the people around them. And I wanted to do this because something very important happened to me last evening. I had one of my kids up visiting for the weekend, and this particular child of mine has never really talked very much about the fact that her mother and I split up over 5 years ago, right in the midst of my own deepest rut with depression. And she wanted to get my insights on what depression is and how it feels. Long story short, my beautiful child and I wound up having a very intensive 3-hour talk, and it dawned on me that this is a topic that I've not shared on this channel before, which was the impact on those around the person suffering from mental illness. So here we are. Now, one of the things that I realize now, looking back a dozen odd years, is ignorance. Ignorance on the part of I'll call them the patient or the victim themselves. You feel down, sad, you've lost interest in things that you used to do, you don't want to leave the house. You're either super hyperactive if you're bipolar, or you sleep in bed all day if you've got, really deep, what I'll just call typical depression for months at a time, which was like me. And you don't know what's wrong with you. So that's one aspect. But then an extension of that, even once the person receives help, which is only a starting point, let's face it. It's not, I'm going to go to the doctor and get a pill, and the next morning I'm fine again, and everything's back to normal. I think anyone watching this channel who've been viewing the numerous videos that I've been posting know that whether you have anxiety or depression or any other mental illness, there are no quick fixes. So, it's a start. It's a necessary start to speak with a professional. But what about everyone around you? So I think back to those years when both of my children were quite young, neither were teenagers yet, and they would come home from school and find their father, me, laying in bed still from the morning, drugged up by my physician on prescription drugs. I mean, it wasn't like at that particular point I was doing anything super wonky, but how is a 7 and a 9-year-old expected to feel when they walk into the bedroom wanting to jump on Papa and tell him about their day, and Papa's half awake, and even when he's trying to put a smile on his face and he thinks about the words that he wants to come out of his mouth, but when he opens his mouth, it's nothing but garbly-gook because he's so doped up on antipsychotics, tranquilizers, antidepressants, you name it. How are these children feeling? And what is their impression of their father? I mean, don't forget, young kids look to their parents as an example, a role model, but also as stability. So what happens when you're one of the two pillars of stability in your life suddenly is acting a little on the quirky side? I mean, one thing I was able to do was, when I was with my kids on my own, was mask the depression. I'd act happy, I'd arrange things in such a way that we didn't necessarily have to leave the house, and they were young enough that, the whole TV babysitter thing kind of worked, and at their age, I was able personally to enjoy a lot of the stuff on TV they were watching. You know, they were well past Barney, let's put it that way. So I was into the same type of entertainment that they were. So we were able, the three of us, to cuddle up on the couch. And little did they know, I was hiding how I was feeling so inadequate inside and alone and that type of thing. But still at the same time could appreciate just having each of them under each of my arms while we would be enjoying a TV show that they liked or a movie or whatever. So I did a pretty good job of that, I must say. I should go into acting. But when your kids come home and they find you that drugged up in bed, just imagine the confusion going on in their minds, let alone my wife. And little to my knowledge, she got on the phone with my mother and was just beside herself thinking, what the heck is going on? You know, why is Dave acting like this? Like, I don't get it. And anyway, through this conversation that I had with one of my kids last night, discussing what depression feels like, I did suggest to her that, well, you know, one topic or one angle you can take with it in your presentation for school. And by the way, I'm very proud of you for picking this topic, because she could have picked anything she wanted, is don't forget about the people around the person who is suffering. They're suffering too. It's almost like alcoholism. You know, it's not just the alcoholic that's impacted, it's the people the alcoholic lives with. They have to put up with them. They have to put up with the lack of energy. They have to put up with the months of not mowing the lawn, even though he always did. They have to put up with making arrangements to get the kids taking places when he used to do that sort of thing on weekends, but now no longer has the gumption to get out of bed and to answer the children's questions about, why is Papa sleeping all the time? You know, he never used to. So I just relay this to you as a fellow champion in attempting to take on depression and live through it, to understand, not in a way to put pressure on yourself, but to understand it isn't all about you and how you're feeling. Now it is, I'll give you that. But we can't totally dismiss what's happening in our households if we happen to live with other people or our co-workers. And don't be fooled, by the way, that these people are not noticing changes in behavior, drastic changes in behavior. Essentially, the bottom line suggestion I'm going to offer, and this is not to add pressure to your current circumstance, so please don't misinterpret me, but I want to impress upon you that it's probably healthy, when you think about it, to consider the impact of your disease, which is a real bona fide disease, and it's not your fault, but it does have an impact on those people around you. And maybe in some way, because you love those people or care for them or they're friends of yours, whatever, maybe in some way that can act as an incentive for you to continue to receive support from a professional and be cognizant of that. Because one thing that I talked about last night in helping one of my kids to prepare their presentation was how often over the last 40 years of my life, I've heard the phrase when someone commits suicide of, oh, how could they do that to their kids? How could they how could they do that to their family? What were they thinking? Well, I use that as an example with my child, not to spook them because I don't have suicidal thoughts now, but to educate them about the fact that when someone is severely depressed, it's like, or at least in my experience, is like your scope of thought, instead of being open to everything around you and taking everything into account, it closes. And you're like in a pit and you've got tunnel vision and you may feel low self-worth. You feel like a burden on your family, especially when you do notice the impact of your disease on those around you who rely on you, and how worried they are for you, and well, gee, they'd be so much better off without me, or whatever. And you start convincing yourself that the rational choice is to, well, commit suicide. And to understand that these people that take that dramatic step and actually succeed are not thinking straight, but they're also not being selfish. They truly think they're doing something positive for the people around them. They're relieving their family of a burden, and they think the world will be a better place without them. And naturally, they will escape the pain. So I think by considering, when you're ready, the impact of depression on your family or whoever's close to you will help to maintain that outer perspective a little bit more. It'll possibly help your mind to minimize the attraction to being so narrow focused on the sadness, the pain, the guilt, all of the disappointments, all of the things that run through your mind when you're depressed day after day after day, and you don't even have the energy to feed yourself, or you're overeating, or whatever the case may be. So this is something you can thank my eldest child for, because it didn't occur to me before, but it certainly had a big impact on my life. Not for the better, but again, all of these uploads to YouTube are for your benefit, to learn from my experience, if it happens to apply to you. So as always, and I thank those of you who already have, leave a comment, subscribe. I will be continuing to upload videos as often as I can. And remember, there is definitely help out there for you, and tons of people that care for you, whether you think so or not. So take care, be well, get help, and have a great day.